Welcome to Health Professional Radio. I'm your host, Neil Howard. Thank you for joining us again. Today, up to about 60% of elderly people develop delirium during hospitalization for some injury or some type of unintentional fall. Well, joining us here is Dr. Franco Garcia. He's joining us here from Massachusetts General Hospital to talk about some data that was presented during the 2021 American Geriatrics Society's annual meeting. Welcome to Health Professional Radio. Dr. Garcia, thank you for joining us.
Thank you, Neil. Thank you for the invitation.
Well, we were going to talk about elderly people and delirium. Give us a bit of your professional background and talk a bit about your role at Mass General.
Yes, so I am a geriatrician. I trained in Mass General and have been working since for the last almost 10 years now. And my role there is I lead a program called the Geriatric Inpatient Fracture Service. Mm-hmm. That is a co-management program that Geriatrics has with orthopedic trauma, where geriatricians are involved in the care of older adults who are admitted to their service from injuries related to falls, like fractures. Mm-hmm. Hip fractures is the most common presenting injury that requires surgery. And of course, as we know, outcomes in these patients, particularly with hip fractures, can be a little bit complicated. So we try to help to improve and mitigate those potential postoperative complications.
Just for clarification, define delirium.
So delirium is probably one of the most common complications following hip fracture surgery. Mm-hmm. And it's an acute confusional state where patients' cognition becomes impaired. They often become disoriented. They often become either very somnolent or very hyperactive to the point that they can even hallucinate. And it's often transitory. So patients, will have a few days in this confusional state. But unfortunately, in many patients, it could lead to a more prolonged or even sometimes permanent deterioration of their cognitive status or cognitive function.
Now, you presented some data from a study at the 2021 American Geriatrics Society's annual meeting. Talk a little bit about your study. What was its purpose, and what did you find out ultimately?
Right. So we know that there are several risk factors that could predict delirium. So in our service, since we do a comprehensive geriatric assessment to all of our patients over the age of 65, we wanted to look to see if screening for nutritional status would tell us a little bit something about the risk of patients developing delirium after surgery. So in these patients, we used commonly known and already standardized scale called the Mini Nutritional Assessment Short Form, or MNA-SF, which asks us, 5 very simple questions that could tell us whether a patient is at risk of malnutrition, whether the patient is malnourished, or if the patient doesn't have malnutrition. And what we found is that for every point decreased in the MNA scores, patients had 14% higher risk of developing delirium. And in patients who were screened as malnourished, they were twice as likely to develop delirium in the hospital. So these we thought it was important to share because it's a simple screening tool that people can do and could also help predict or help stratify patients who might be able to or might be at risk of developing this complication, and then perhaps do some interventions to try to decrease the presentation of delirium.
Are these findings based on people who were in nutritional distress prior to being studied, prior to going into the hospital for the injury? Were they malnourished while in the hospital?
Right. So these patients were, it's a sample of patients who just come in with they fall and break the hip. So we find everywhere from patients who were already malnourished to at presentation, or patients who were not. One of the caveats is, in particular this patient population, is of course that nobody can predict a fracture or know when they're going to fall or have a fracture that will require surgery. So interventions or nutritional interventions before this, cannot be established. But it could also serve as a predictor of, or we think that in patients who might have elective surgery, that a nutritional status could help improve their outcomes following surgery.
You mentioned that there were several risk factors for delirium after an injury while hospitalized. Wouldn't malnutrition exacerbate any cognitive function in someone that old who is also in recovery from the surgery under certain medications, who may be in a state of delirium as a result of age or Alzheimer's? Right,
exactly. So some of the risk factors for delirium that we know of are, of course, the older the person is, the higher the risk. Also having some pre-existing cognitive deficits like dementia, like Alzheimer's dementia, some medications that are commonly used for treating other conditions, like sleep medicines or medications that have anticholinergic properties. All of those risk factors are known to be potential exacerbators of delirium. Now with this, if you on top of that have someone who's also not very well nourished or dehydrated as well, that increases the risk of this condition.
So based on the findings, how do you think the treatment landscape will change going forward?
So that's a very interesting question. That's something that we're looking to establish is what sort of nutritional interventions can we do in this patient population to try to improve this risk. Now, just the nature of presenting with a fracture and a trauma, and all of these patients needing to go to surgery, ideally in the first 24 to 48 hours after they have a fracture, there's not a lot of time that you can do to implement nutritional interventions. But what we're looking for is maybe if after surgery, if there are some nutritional supplementations or assistance with feeding during that type of hospitalization, if that could help reduce the risk of the postoperative delirium.
Well, give our listeners a website where we can learn more about this study and your research, and also about Mass General.
Absolutely. You can visit us at www.massgeneral.org.
Dr. Garcia, I appreciate you joining us here on Health Professional Radio.
Thank you, Neil. Pleasure to be here with you.
You've been listening to Health Professional Radio. I'm your host, Neil Howard, in conversation with Dr. Esteban Franco Garcia. Audio copies of this program are available at hpr.fm and healthprofessionalradio.com.au. You can also subscribe to the podcast on iTunes, listen in, download at SoundCloud, and be sure and subscribe to our YouTube channel at youtube.com, Health Professional Radio.